enlightening words, let's start this beautiful evening. I, Dr. Mahima Singh, on behalf of Pratibha Institute of Business Management, welcomes our Secretary, Dr. Deepak Shah Sir, Director PIBM, Dr. Sachin Borgave, Professor Gururaj Dangare, convener of this webinar, and HB MBA, and today's speaker, Dr. Garima Singh, and all the participants who have joined today's international webinar on wellness and mental health care in COVID-19. A very warm good evening to you all. Now I request our director, Dr. Sachin Borgave, to please enlighten us.
Hi everyone, very good evening and welcome to the second international webinar organized by Pratibha Institute of Business Management, Pune. And today's topic for this webinar is quite essential. It's a wellness and mental health care in this backdrop of COVID-19, and which is quite essential. And I'm very much glad to have a very eminent personality, a very eminent doctor, a psychiatrist, chief medical officer from Missouri. I request, without taking much time, I request organizing team to start this webinar at earliest. Thanks.
Thank you, sir. Now I request our HOD MBA, Professor Gururaj Dangare, to say a few words about today's webinar.
Very good evening to all the participants. This is indeed a pleasure to welcome participants from more than 20 countries to listen to the great personality, Dr. Garima Singh. The topic is quite essential in this pandemic situation because people are suffering with various mental depressions, and it's necessary to enrich self by understanding how we can maintain ourselves fit in this pandemic in spite of several economical slowdowns. How a person can keep himself or herself ready to face situations, because in this process psychology plays a very important role, and that was the basic motto behind organizing such international webinar, so that we can serve the society as well as the people from various countries. And I'm glad that Dr. Garima Singh has accepted our invitation, and she is going to enlighten all the participants towards her wisdom. And I am sure after this session, participants are going to see changes in themselves and taking things in positive way. I request participants, after her session, we are going to have a question answer session, and people can raise their question in chat box. Some selected questions we are going to convey to Dr. Garima, and some selected members we are going to ask them to raise hands so that they can directly interact and others can be benefited. So rather wasting much time, I again welcome all the participants for this great initiative by PIBM. Now I hand over to the Dr. Mahima Singh for the further process. Thank you so much.
Great leaders don't set out to be a leader. They set out to make a difference. It's never about the role, but always about the goals. And Dr. Singh is a real leader in true sense. Dr. Garima Singh is a child and adolescent psychiatrist and works as a chief medical officer at Bureau Behavioral Health in Columbia, Missouri. She also serves as a faculty in the Department of Psychiatry, University of Missouri, and is an expert panel for eco-child psychiatry. She is a triple board certified in general psychiatry, child and adolescent psychiatry, and addiction medicine. Now I request Dr. Singh to please take over the session. Dr. Singh, just wait for a fraction of a second. We are making you the host for the session.
live streaming.
We are also giving the YouTube live streaming, those who cannot join us on Zoom.
They can directly connect.
They can directly connect on the YouTube live. The link is given in the Telegram group.
Thank you for the warm welcome and good evening, everyone. I know it's good evening for you and good morning for me. So thank you for joining us. I know I see a couple of chats about people not being able to hear well. If you can mute, and I think that would be helpful for the audio to be better. Another thing, please feel free to chat if you have a question as we move on to the presentation. I always feel it's better to tackle right there. So just ask your question. I'll try to answer right then or at the end. So with that, let me share my screen and begin the talk. Okay, can you let me know if you can see my screen? Can somebody chat or let me know if you can see my screen or tell me? Okay, here you go, I can see that. Okay, perfect. Okay. So we are going to talk about mental health today. And why are we doing that? Because it is very important. And I think we still have a lot of work to do, especially in India, to raise awareness and to let people know about it. So I'll let you guys know a little bit about it. Before I start, I'll tell you a little bit about myself. My name is Garima Singh, and I am born and raised in India. Moved to US, I would say in 2008, and has been practicing medicine here. Mahima Singh is my sister, as majority of you already know. And it's really a privilege to be here and talking to you all about something which I am very, very passionate about. So let's talk about wellness and mental health care in COVID-19. And rather than COVID-19, I just first want to give you guys an overview, and then we'll talk more about the impact what COVID-19 did to our mental health. Okay, I have no financial disclosure to make. Nobody is paying me any money or grants or anything to talk about this and give this presentation. Let's talk about the objective. Why are we talking about this? So we are basically trying to nail down some of the points. One is to discuss the impact of COVID on mental health. We'll talk about some of the common and complex psychiatric disorders which happens in day-to-day life and are prevalent all around the world. We'll talk about some of the prevention. What can we do? What's the treatment modalities available? And then I'll give you some of the resources in India. There is a lot of services. Okay, she sent me a message to make it full screen. I thought it's full screen. Is it full screen now? Okay. Perfect. Okay. So here we are. And then I'll give you some of the resources. I am very glad to hear there are so many NGOs, voluntary psychiatrists, a lot of hotline crisis number, a lot's going on in India, the unfortunate pieces that people are not aware of it. So the whole idea is to make people aware about it and to use those resources when needed. So let's get to our previous point. Why are we talking about it? I'm sure on a Friday evening, nobody wants to hear a lecture about mental health. So why are we talking about it? So here is why we are. According to WHO, 1 in 7 individuals suffer from mental health in India. Over and over, the studies show that this number is not the exact number because people are not going to get the help. It's underreported. People are not seeking help. They are not knowing about it. So unfortunately, even though we say 1 in 7 individual, which is still a very big number if you think about it, but still that's not the right number. So most likely we are having more people suffering every day in their house without getting the help. And if you look at the world census, it's 1 in 4 people, a lot of people. So 1 in 4 of us is struggling and unfortunately not getting the help. So 7.5% of Indians suffer from some form of mental health problem. And when we talk about mental health, it's a big spectrum. There are multiple things which come under it. One of the most common ones, which we hear in our day-to-day life, is like depression, anxiety, social anxiety, panic disorder. But there are other ones, and some of the major and complex ones, like schizophrenia, psychosis, attention deficit, autism spectrum disorder. There is a big magnitude and a big spectrum which goes from one end to the other when we talk about mental disorder. Then the most recent census talks about that 150 million people in India need active psychological intervention. The sad part of it is, yes, these are so many individuals who have been known to have problem and seeking help. However, to serve that population, we only have 30 million people who have access to mental health care. We talk about the shortage of psychiatrists, mental health professionals in America. When we compare that to India, and I was amazed at those numbers, how underserved and how much need of mental health professionals are in India. Just see 30 million access to mental health and 150. So that's 5 times more people needing care, which is not available. Approximately 1 person dies from suicide every 40 seconds and 20 others make suicide attempt. We don't talk about it. We don't let people talk about it. You know, I get amazed all the time when you look at social media. People talk about diabetes, people talk about hypertension, people talk about getting diagnosed with cancer. Why nobody talks about suffering from depression or anxiety? Why we just want to brush it under the rug and don't talk about it, and then it ends up in such a bad conclusion. And the thing is, think about why a person have to take their life, how much they are suffering that ends up with the person dying or taking away their life. And then we often talk about copycat suicide. So you see a person, a role model or a TV actor or somebody following through with this, and then we see in nation more friction about it. Now people who are suffering from it thinks that somebody is dying and then they copy it. But my point is, and I really want you to think about it today or following after this talk, what makes a person take their life? Think about how much are they suffering and struggling without getting the help, then they end up taking about suicide. So that's not something which we can just brush it off. That's something which we need to think about and make people aware about it and follow through it. So let's talk about, and all the statistics is pertaining to India. It's a problem, it's a stigma everywhere. But I think the way we are struggling in India, that really needs to be reformed and we need to talk about it. So after this talk, even a one of you think about it and do something about your mental health, I think my job is done here. So let's talk about it. Why mental health is such a problem or stigma in India is the big question too is judgment. We judge people. We judge when they come to seek help. We judge people thinking about, one of the family member in their family or one of the somebody in that household is crazy. The terms which I never hear, I hear about it when we talk about psychiatry and mental health. Crazy, mental, mad, retarded, stupid. Do we call any of our patients struggling with cancer or anybody suffering from diabetes or hypertension? Do we use any of the words for them? Then why for mental health? Why we are not targeting our mental health as important as our physical health? And that's what's the statistics, which is most alarming, is that 47% of Indians indicate higher judgment against people perceived as having mental illness. And that is very, very sad. And I don't think we need to be blaming or pointing finger to society about it. I think we, each of us, including me, are somewhere to blame for this number. Because why we are judging the next person who's seeking help or coming with their problem and thinking about that they are not doing because of the choices they are. Because unfortunately, that's not the choices that person is making. That's something which is happening to their body, to their biology and things like that. And that's predisposing them to that risk. And that's what is the result which they are struggling with. Okay. So, and I already talked about insane, crazy, mad, mental retardation. Please don't use those terms for a sickness, for a disorder. That person is genuinely struggling. And instead of seeking the help and being the support, we should not be labeling them or calling names. So in the same line, let's talk about suicide. Most common cause of death in 15 to 29-year-old and 15 to 39-year of age is suicide. That's our young adults. That's the youth. That's our next generation. That's the big part of our people who are struggling and not getting the help. Between 1987 to 2000, suicide rate increased from 7.9 to 10.3 per 100,000. And that number increased further to 10.6 per 100,000 people. And you know, there is two pieces to it. How many of this are reported and how many of these are not reported? We know a big part of India is rural India. And we know how much our rural India, when we talk about judgment, we talk about society, we all know how our rural India works and how the society plays an impact to it. If we are talking about not coming forward to seek mental health in our urban area, in our urban India, I can only think about what's happening in the rural area, India, and how much underreported that information is. When we talk about male, I know it says somebody raised their hand. Do you want to wait till the end or ask a question now? Diksha Sharma. I think why don't you chat your question and then maybe we can get at the end of it. So, and that's the other piece of it. The other piece is when we talk about suicide globally, internationally, the number of completed suicide is more by male than by female. Studies over and over again show that males complete the suicide more and females attempt more. And there is a lot of impulsivity and a lot of things which plays a role in that. So that's the other piece of it, that men complete more suicide and the females attempt more. So I tried to talk about it, but let's talk a little bit more barriers of seeking mental health, especially in India. We already talked about social stigma. Growing up in India, I honestly can say I never ever heard somebody coming to our house and saying, oh, I have schizophrenia or I have depression or I have anxiety. I grew up in a middle-class family. We had multiple guests and visitors coming to our house. I never heard that. Did I hear people suffering from cancer? Yes. Did I hear people suffering from diabetes? Yes. Hypertension, pneumonia, fever, stomachache, headache, everything. And I grew up in urban India. So that's one piece of it. We don't talk about it. And then there is social stigma. I was watching a show on Netflix the other day about Indian wedding. People don't want to marry their kids where there is a history of mental illness in the family. How petty is that? Do you ever go and ask someone when you go for a matrimonial or a relationship, oh, do anybody in your family die of cancer? Oh, but if you came to know of that somebody in the family died of a suicide, we are not going to have a relationship with that family. How petty is that? And that needs to change. We need to give as much importance to mental health as to physical health. because your body is not going to work if your mind doesn't work. And the people who can change is the youth like you. And that's why I love giving talks to the youth people, because if anybody can make the difference, that's you. You are the next generation. You are going to have families. You're going to have kids. And that's what the change starts from each one of us. We cannot expect that the reform and change is going to come from the government or from the nation. The change comes from us. Every day, if we learn this world is going to be a better place. So one is social stigma, the other is culture and beliefs. I live here, I see all kind of people, I see all the religion. Religion over and over and over, our culture talks about how suicide is a crime. The Catholic people believe in it. Islam says that. Hinduism says that. Life is precious and we need to believe it. So why, and I remember when I was in med school, suicide was considered a crime. When I was in medical college and we had patients coming in the ER, in the emergency room with having suicidal thoughts or attempted suicide, we immediately called the police. Now looking back, I'm like, wow, did we really do that? We did. I am so glad that the Indian Psychiatric Society had the reform, and now the suicide is not considered a crime. For a person to take that step to end their life, to end their struggle, and then we call it a crime and make it a legal problem, that's kind of sad. But I'm very glad that we have done this reform and we have moved in the right step. The other point is lack of awareness. And we kept on talking about it, lack of awareness. People don't know about it. I often hear that people saying, brush it off, knock it off, sleep it through. I'm a child psychiatrist. I see kids, young adults, college kids, and I often hear parents coming in my office and saying, oh, he's just so lazy. He just wants to spend all the time in his room, on his bed, playing on social media. And I talk to the kid and he's like, no, I don't play social media. I just don't feel like getting out of my room. And my parents don't get it. And they just keep on saying, knock it off. That's not knock it off. Yeah, half of the time, teenagers, I get it. We do need them to knock it off and give their phone. But there is sometimes reality to it. And so as a parent, as a teacher, as a guardian, it's a responsibility to understand what's going on in our kids' life, why they are not doing what they are supposed to. I get a piece of it. Yes, they want to sit in their room and play video game. Yeah, that's a different kind of story. But there is lack of awareness in parents, in teachers, in our kids, and everybody needs to be educated about what to look for. Accessibility. That's the again thing we talked about, the big proportion of the people needing the help and not getting the help. I don't think mental health access should be such a problem. We all should have an easy access to a number, a doctor, a provider you can reach to when you need the help. Infrastructures. I was talking to one of a psychiatrist in India, and I was shocked to hear the majority of the big health insurance system does not cover mental health. How sad is that? If my insurance is not going to cover to mental health, how can I give importance to it? We know money is tight. We know everything costs money. And then if it's going to cost me so many dollars or rupees out of my pocket, yes, I'm going to think 100 times before I take that step. So I definitely think there is a big reform and policy changes and the drive that needs to happen so that this gap can be bridged and mental health can be provided to everyone right in where they are, it's in their home. The most beautiful thing which happened with COVID is the Zoom and tele. Who would have thought I would be sitting here oceans away, continents away, and talking to the people in India? Technology has been beautiful and has been most helpful to us in today's life. Why can't we just do tele to people where they are? Wherever there is internet, we reach out to the people and serve their mental health and provide the care they needed. We need big reforms in our health insurance, our coverage policies needs to be reformed. A lot of work needs to be done. And I am very proud to say that the Indian Psychiatric Society is doing a lot of work, but we do need to spread the awareness and move in the right direction. So we briefly talked about all these barriers and kind of set up the stage for COVID-19. The world was going fine. We all were complaining, going in our day-to-day life. Kids were going to school. We were going to work. Things were happening. Everybody was in the monotonous lives. And then a global pandemic happened. The world almost came to a stop, locked down from states to states, countries to countries, continents to continents happened. The kids who complained about going to school now are dying to go back to school and see their friends. People who complained about their colleagues now dying to go back to where they were. So it impacted our world in a big thing. A thing like this, which impacts the world, what do you think does to your mental health? So big reform came about, social distancing, right? We had a lot of controversy. In the world of psychiatry, we don't like the term social distance. I don't want you to be social distant. I want to have physical distance. We still would like to connect to our family, our friends, our social network. We don't want to be aloof and lonely in this hard time. We just want to keep a physical distance so that we don't spread the infection. The market fell down, the people lost their job, finances went down, a lot happened. And talk about it. Which piece of this doesn't affect our mental health? I work in mental health for last 10 years. I'm a professional. I couldn't sleep for so many nights when this started. So it was a hard thing for professionals. How did the common people struggle with it, who depend on the day-to-day money to pay their bills, kids who were in high school, or kids like you in college who are trying to take their test or go through it and things like that. So it's a lot happening and a lot happened. However, my social media, my WhatsApp group, my Instagram, Facebook, and friends from India posted every day a new recipe. My mom, my sister, my aunts complained about doing the chores. Maid was not coming. So a lot happened. And then the haircut happened. Multiple kinds of different haircuts happened at home. People canceled their vacations. The personal meeting, in-person meetings changed into Zoom meetings. So a lot of good things happened. People got to spend a lot of time with their kids, which in day-to-day life never happened because we all were running the cat race where we were moving from one activity to another, going to one place to another. All of a sudden, you are at home with your family, trying to spend time together or trying to deal with each other. So a lot happened. Together with this, it impacted our health services, it impacted our economy, social isolation. So the kids who used to go to school and hang out with their friends, or our college kids who were going to their college for their classes and meeting their friends, that impacted. And we know we all have been through it. Teenage years, your best friends are more important than anybody in your family. We took that blanket away from our kids. Our kids who trusted in their teachers, who we ripped that blanket away to. And now everything took part of a Zoom and tally. So how much do we give emphasis to technology? There is still a big part of it, which a human connection plays a big part in our mental growth, in our physical growth. And with COVID, unfortunately, that ripped apart. Increase in domestic violence, a lot of studies are coming about, talking about increase in domestic violence, child abuse. There are relationships which are not the ideal, and I see that more in India than in our Western countries. People are stuck in bad marriages and bad relationships. Now the two people who were getting out, going to their jobs, or going to going to different places now are together 24/7, which is leading to more domestic violence, more abuse. We got more and more information about kids getting abused and neglected, because here in the US, as a healthcare professional, as a teacher, as a police officer, if a child is neglected or abused, we are mandated by government to report it. Now the kids are not going to school, they are not coming for their doctor's appointment, they are not going to their practices. So unfortunately, that couldn't be reported, and we saw more and more kids struggling because the parents were struggling. Now they lost their job, they cannot pay the bills, they cannot buy food, and things like that. That kind of, it's a vicious cycle. One family member gets impacted, the whole family gets impacted. We saw more effect in racial and ethnic minority groups. There are a lot of studies done here talking about how African Americans are getting sick more, and some where low socioeconomic status and minority groups are struggling more because they don't have the means now or the support to meet their ends. Physical health started affecting, right? As I said, you cannot separate mental health from physical health. So it's like glued together. Your mental health is impacted. Yes, your physical health is impacted. Now the gyms are closed. You cannot go and work out. Some kind of enjoyment is always good. The movie theaters are closed. There is different aspect to it where you were getting kind of a social support, a kind of a way to recreate, and things like that. It started impacting. So the physical health, the people who were going to get their labs done to monitor their blood sugar level or get to see their doctors for whatever reason, now everybody's getting impacted. We are seeing more obesity. The numbers are going high for obesity and increased weight gain because now you are sitting at home and eating and not getting any physical exercise done. Educational and academic effect, and you guys know better than anyone, right? The classes are not the same as they used to be. Most of the classes ended up being Zoom. Our kids are just sitting at home, and it's different when you are in front of the teacher who's staring at you and making sure you are getting your work done. But now you are sitting in front of a camera, and you have very well have the option of turning off your video and audio, and who knows, you are getting the attendance, and who knows, you are attending or participating or even paying attention. Then special educational services, all the special things which our kids were doing, now they can't do because everything is closed. And it's not bad. It's just the risk and benefits. We always have to weigh it. And we had to do that to prevent the spread. But unfortunately, that impacted each one of us in our day-to-day life. The other problem as a working parents, and especially for essential workers, my biggest problem is childcare. Yes, I have to come to work. My husband has to come to work. Who takes care of our kids? What happens to them? Healthcare, housing, disability services. It's a big paradigm and a vicious cycle which keeps on circulating and which is impacting every spectrum of our life, affecting our mental health. Tourism, people who work in tourism got impacted, like people got bankrupt, organizations got closed. That's a big problem for the people in business. What about us? We were looking at the tourism and vacations to decompress. Now you can't. You are just stuck in your house doing nothing. Don't you think that impacts the mental health? Art and culture, all major exhibitions, museums, everything got closed. People who were doing lessons, studying. I was reading yesterday that people who are in law school, they cannot take their exam, and for that they can't get a job. See what's going on with them, what stress level they are going through. And if we don't talk about it, how are we going to deal with it? How are we going to help with our wellness? Okay, so let's talk about risk factor. I need to keep an eye on the time. Okay, so let's talk about risk factors. So what makes me have depression and you don't have depression? Or what makes you have anxiety and I don't? I always tell this to my young kids. We get our brain, our beauty from our parents, we do get other genes, and some of those genes predispose us to diseases. Psychiatric illness is not like blood pressure or diabetes. I cannot come with a number and say, hey, your blood pressure is over this, you have high blood pressure. Your blood sugar is this, you have diabetes. Mental health is different. There is more to it. There is a lot of subjectivity to it. There's a lot of unknown factors. There are a lot of things which people don't know about. So all this factor which has been studied to be contributing to your mental health, some of this predisposes to risk factor. Genes play a part of it. When you have family members who struggle with mental illness, you have more chances of having it. As with majority of diseases, including your physical illness. If you have diabetes in the family, you have high risk. You have high blood pressure problem in the family, you have increased risk. You have family history of breast cancer, colon cancer, that predisposes you to high risk. The same way, majority of the psychiatric illness, there is an increase in the genes. Then we talk about biology, balance of chemicals. Psychiatry is not just talking about it. There is science about it. There is neurochemicals in it. For example, I always give this example to my kids who don't want to take medicine. When your eyes are weak and you wear glasses, do you have a choice? You don't wear glasses because then you won't be able to see. That's exactly what mental illness is. There is neurochemicals which play different roles in our bodies, like dopamine, serotonin, norepinephrine, acetylcholine. There are different neurochemicals. The balance and imbalance of it leads to the symptoms which we all suffer from time to time. So now the big question is, how do we know what's the imbalance is? We only get to know that if we seek help, if we get to the person who can help you with what's going on. I often ask, I don't want my kids to be on pills. Oh, the psychiatrists are pill poppers. No, that's not true. I would say, and I can say that for majority of my colleagues, I won't prescribe anything which I don't feel comfortable prescribing my own child. I treat every kid as my own kid. So no, the psychiatrists are not pill poppers. You are going to get the opportunity to go through the different modalities depending on where in severity is your illness. The other question which I get asked more often is, do I start the medicine? Do I have to take it for the rest of my life? The answer is no. And it's highly dependent on what's going on. Which severity is your sicknesses? What other modalities do we have? How do you deal with your stress? What's going on? So there is a lot of things which plays a role before a pill is prescribed. Or if it's prescribed, is it short-term? It's long-term? There's a lot of component which plays in role. Then your environment. I often talk about this environment to my college kids. So here is the point, okay? We all have been through it. We all had friends. I am having a bad day. I go to my friend and say, I'm having a bad day. Now, what does your friend say to you makes a big impact in your college life? Because we want to be popular. We want to have friends, right? Is your friend who says, oh, you're having a bad day, let's go to bar and drink tonight. Or you have a friend who says, oh, you're having a bad day, let's talk about it, what we can do different. Surround yourself with people who are positive and who are honest and are going to direct you in the right direction. Not a friend who makes you sit in the bar and pass out. You might need to have it. Surround yourself with friends who can help you at the right time. And your lifestyle. You can, I can talk about it day and night about lifestyle. We can complain about it and stuck ourselves in a room, or we can motivate ourselves and follow a good, healthy lifestyle. Over and over, I can't tell you how many scientific literature has been published over and over again that physical exercise releases serotonin and dopamine as one of the best antidepressants you can ask for. So if nothing, at least get yourself into a rhythm or something to do for yourself and for your wellness. So, and then these are some of so we talked about the risk factors, previous suicide attempt, history of substance abuse. That's the other thing which I feel like our young generation is really struggling. When we were growing up, going to bars and partying was not as common as it's now. So, we have to be careful about the choices we are making now. Because the choices you are making now, you're going to live with it for the rest of your life. And I want to tell all these young people, till 25 years of your age, your brain is still developing. I would do everything in my capacity to increase my IQ rather than lose it. But when you do drugs or when you drink alcohol, the other common thing which in India is these days are marijuana, ganja. People are smoking. It's more fashion, it's party and things like that. However, the one thing which I really want you to know is ganja increases your risk to have schizophrenia and psychosis. And you don't want to lose your smartness and intelligence just to party or be cool. Okay, that sounds like lecturing, but that's true lecturing. Then physical disability, illness, anytime you have a physical illness, that impacts your day-to-day functioning, impairs your physical well-being, impairs what you can do in your social environment, definitely affects your mental health. Losing a friend or family member to suicide, that's a big risk factor because I can't even imagine what you go through when you lose a family member, and that due to suicide, which is majority of the time very sudden, you don't know about it and what that impact causes to the family. Exposure to bullying. Bullying is another big thing which is impacting our young people. And bullying has taken a whole new form with the social media. Now you can basically ruin a kid's life just by spreading a rumor on social media. So we have to be very careful about bullying, what we are posting. I always give a whole new lecture about bullying and social network and things like this to my young kids and my parents about what safety networks you need to know. But be very careful about what you are posting on social media, especially what you are posting about other people. Is that going to affect that person's life to that end that can lead to having them being ill or sick? Mental health condition, death of family member, access to harmful means. And that's what I hate about guns. Because sometimes that impulsive decision in a second can end a life. So we have to be careful about what access do you have. Do you have just pills lying around in your house? Do you have means to access? Because sometimes ending a life is a 1 minute sudden decision. And unfortunately, there is no coming back to it. So that's kind of talking about the neurobiology of suicide. So that's more about so it's a balance about what's the risk factor, what's the protective factor, how do you cope? And the balance of this leads to what causes the mental illness. We all deal with stress very different. I can have a conflict or I can have some stressful situation. How do I deal with it? That's one of the things. And I really feel our youth needs to be very resilient and have to have a very good coping mechanism. So it's life. We all will have negative things back, coping mechanism, and that's where this fine balance of your mental health plays in. And we already talked about genetic, childhood traumatic events, psychiatric disorders, stress from financial, suicidal behavior. I think we have already talked a lot about it, so I'm going to run through it. I really want to answer your questions because I want to meet where you are. So I really want to run through this so that we can answer your questions. These are some of the protective factors. I can tell you over and over again. When you are 13 and 14, you don't feel that way, but your parents are your best support and they got your back. So they might think different because I think the way my parents think mental illness, I think different. So there is going to be, but at the end of the day, they are your well-wishers. They want the best for you. Academic achievement. You do want to grow, learn, increase your knowledge. awareness and access of local health services. I'm going to list some of, especially in the Mumbai area, some of the psychiatrists who are voluntary providing mental health care. And I do have the resource sheet at the end. So if any of you need access, there are people who are providing it for free of cost. Neighborhood safety, check on your friend, check on your neighbor. Ask them, are you doing okay? And be a good listener. When the other person says, I am not doing well, don't say, knock it off. Listen to them. What's causing it? What's going on? How can I support you? What can I do for you other than going in a bar and drinking? So think about it. Have good resilience. We need to teach our youth. We need to teach our young kids. Things are not going to go the way you want. There are going to be disappointments. There are going to be disagreements. There are going to be breakups in relationships. How do we come out of it? And the way we need to teach that is to come out stronger for them by being there for them. Closeness to caring friends, social safety. We have to make sure our school, our colleges are safe. There is no easy access to weapons and things like that. Sometimes, and depending on where in the every family is different. Depending on where you are, you might not have that connection to your parent. Then you need an adult you can trust. It can be your teacher, it can be your professor, it can be your counselor, it can be anybody, but some adult where you feel you can connect to and get the support you need. And I already talked about this clinical manifestation. Sometimes, you know a person who has always been good. Now they are very pessimist. They are, have been passive aggressive. They're isolating themselves. They are drinking more. They are talking about dying. Get help. This is not normal. And, happening for a few seconds is a different story. If it's happening consistently for days, weeks, months, you need help. Then COVID and mental health, we saw a great increase in mental health needs with COVID, which is not a surprise. We knew that. And we also are thinking that after this COVID peak, we are going to have a mental health peak because a lot of people lost their jobs. A lot of people are financially struggling. Our kids are not doing academically so well because they are not going to school and college. And the online is not the same as going to school and college. 1/3 of healthcare workers and their family reported worsened mental health. Yes, we do. We do care about our families who are serving in hospitals and clinic and getting exposed. We do worry about it. There has been an increase in the prescription of psychotropic medication. There has been an increase in the crisis call. That was the whole reason why the Indian Psychiatric Society came up with that voluntary list of psychiatrists whom you can call because there was so much increase in crisis calls. Some of the red flags and warning signs to look for: your feelings, your lack of interest. Oh, I used to love playing guitar. I don't do that anymore. What's going on? Why not? Think about, check for yourself, check for people around you. Concentration. I can't concentrate. I don't feel motivated to do things. You have sleep problems, things like that. But as a parent, it's our responsibilities to watch them and make sure what they are surfing or where they are going or what they are looking for is safe. Okay. And somebody also asked me how to distract with the fear of COVID. So I think that's the thing is, we need to be aware. We need to do our part. We need to have the due diligence, educate ourselves, and prevent as much as possible the risk of getting the infection. However, if we do get the infection, then we have to know how to get the care which is needed. Okay. Okay, it's 10:09. I'm going to take one more question and then I'm going to give it to Dr. Borgov. Okay, when we talk about barriers, don't we think the biggest factor behind the barrier is the monetary factor? Because each and every point is highlight the monetary term. Today report says a man sells his house just to get a smartphone for her daughter to attend the online classes from you. Money is definitely a barrier. That's a big impact. That's where all the socioeconomic status and everything comes in place. Yeah, money is a big barrier because money leads to, so as much as we want to say that money is not important, you don't deny it. Money is very, very important in our primary life, to pay the bills, get the money, have a house over our roof. It's important to get education for our kids. It's important to hold a lifestyle. In my growing up, my father used to make this joke that in the past he used to say, for Saraswati you don't get Lakshmi, but nowadays you can't get Saraswati without Lakshmi. So, you cannot deny the fact that money is very, very important and is a big barrier in seeking help. And that is why the mental health is so important, because that's the problem. If the insurance is not going to cover the mental health, how we are going to seek mental health when we say it's as important as physical health? Okay, guys, I think that's all the time I have to answer your question. I absolutely love the participation, and would be happy to talk again if our time and our busy life schedules work. I would love to talk to you all again and answer your questions. So thank you.
Thank you, Dr. Garima. Now I propose a vote of thanks. At the outset, I would like to express my gratitude to Dr. Garima Singh for sharing her valuable time and giving her inputs on the most sought after topic in this Corona period, that is wellness and mental health care in COVID-19. Thank you, Garima. It was a very nice, informative and wonderful sessions. I think you have satisfied most of the participants with your answers. Thanks a lot.
Very good.
This webinar would not have been possible without the constant guidance by our director, Dr. Sachin Borgavik, Professor Gururaj, Dangare, and all the staff members of PIBM, as well as the technical team behind it. And our students committee, which comprises of Mr. Samir Srivastav and Mr. Vipul Bansode. I thank all of them for making this international webinar a success. Last but not the least, I thank all the participants for actively participating in this webinar and making it a success. Thank you all. Now, an announcement. Feedback link will be shared in the Telegram group, and after filling that feedback link, you will be receiving your e-certificate in 2 to 3 working days. Thank you all. A very good night to all of you. Stay happy, stay safe. Thank you, Garima. Bye. Take care.